Like everywhere else in the world, the Yukon needs doctors. Many Yukoners are waiting for one, and the Yukon Party's health critic Brad Cathers says the Liberal government needs to step up with recruitment. How? He says by cutting red tape, boosting incentives, and poaching doctors from the US who might be looking to leave the country.
Frankly, to take advantage of the chaos south of the border to welcome U.S. doctors and other health professionals who might like to move to the Yukon to actually come here.
Cather says American doctors are trained to a similar standard as Canadian ones, and he says the government should act quickly to let them practice in the Yukon without jumping through too many hoops. NDP leader Kate White agrees that these doctors could be ripe for the picking.
The proof is not in the pudding right now, right? So I think there's an opportunity to pivot or to branch out and to go particularly hard for U.S. trained medical professionals right now, and not stop the rest. But the reality is we haven't seen this big rollout as described by the minister.
Now, Tracy Ann McPhee is the Minister of Health and Social Services. She says the government is trying to recruit healthcare workers regardless where they come from. She also points to her department's record $692 million budget as a sign that the government is taking this issue seriously. She says millions have been spent on recruitment and retention.
It is a top priority for us to take every action possible to improve our healthcare system, to improve the care for Yukoners. We know that some of that has been based on the growth of more people living in the territory, and some of it has been based on the expansion of services for Yukoners.
The questions from the opposition come as the Yukon government is about to enter negotiations with the Yukon Medical Association. The Yukon government says a new MOU will focus on key priorities like improving access to care, physician pay, and physician rights. Joseph Ho, CBC News, Whitehorse.